Welcome to Reformed and Real, where we take a journey with our people fresh out of prison and how the community around them really feels. My name is Mario Hernandez, and I am one of the afflicted people that got released back into the community, here to try and figure out how this looks.
And I'm Wayne Burt, curious onlooker who wants to know about our prison system, get to know the stories beyond the stigma of incarceration, and because, like Mario, I believe all stories count. Today, we're going to the front lines. Yeah, we're going to people who help folks that are getting out of incarceration and doing that work. That's a little undervisible, I think. And we're going to talk to a few folks in that world today.
Yeah, we have some unique guests because they don't target people getting out of incarceration, but they're a community resource, and everybody's heard of them.
Yeah, it's Central District Health. We have Christy Lacados, Outreach Coordinator, and Rosie Fernandez, Community Health Worker, joining us today. Welcome.
Good morning.
Thank you.
Welcome. All right, so I want to start out with how we first came across meeting each other, right? And I'm not exactly sure what brought you guys in the doors here at Learning How to Live, but you walked in and...
Yeah, so I would say Christy set up the meeting either with you, Mario, and once we walked in, it was such a wonderful program, honestly. You guys do a lot, and we kind of have a something in common that we want to help our community. And so I think we landed at a good place. Right.
So I guess it's kind of when you wrote me that first email, I remember, and I was like, oh, okay. I mean, I remember Central District Health as South Central District Health from Twin Falls. For those of us that don't know what that is, I mean, it's WIC. Mm-hmm. It's helping women. That's women and children, right?
Infants and children.
Women, infant, children, right? And a very good program that I remember from when I was a kid because we were very poor growing up, and I guess you don't have to be poor, but we were, and the resources are great. So it's not just for people that are out there in need of resources, but you guys also help the formerly incarcerated, right?
Absolutely. We have a program that's called medically assisted for getting off of opioids, and we call it MOUD. And so a lot of times when someone's addicted to drugs, then they can come to see our providers, and we'll give them some medicine to help them. It's completely free for them. So
that's great. What is the biggest barrier to people knowing about this program?
I think it's the commitment from people because it's hard to get off drugs.
Sure.
And so just being ready and knowing that they'd have to come visit the provider and they have to be assessed and make sure that they're seeing them.
Yeah.
It's hard for somebody to make that commitment, especially when you're, if you're an addict and you're addicted to opiates, that is a difficult task.
It's difficult.
I guess.
Is it a program that gets, that refers people that are addicted to, or?
So at first it'd be if they were already getting the assistance, and then once they get out of the prison system, then basically we would take over.
Gotcha.
Okay. But now our providers are familiar with it, so now they can start people on it.
Yeah, and not only that, it would be like the first place to go if they're needing a checkup, if you're needing immunizations, if they're needing just a general checkup as a woman or a male, birth controls, immunizations, I already said, just different things like a family clinic. So we're there.
So do you guys communicate with IDOC to make that connection?
We do. So I actually call and just talk to the case managers and the management and just see if they can talk to the folks and supervisors and just make sure that people know that we exist, because I think it's public health. Yeah, a lot of people forget about us.
And they're actually right in front of across the street from us, so they can actually walk to us. Yeah.
Oh.
Yeah, not bad.
That's kind of a resource that I've never heard of it, right?
Yeah.
For that, especially when it comes to checkups and when you first get out and you want to find out where you're at, right?
Right.
People go to health and welfare and they get Medicaid, and I've never heard anybody say, you know what, Central District Health does that. So that's amazing. So how would somebody go about applying for that?
You don't even have to really apply. You just are you talking about
an appointment?
Yeah, make an appointment. That's all they have to do is to call. Mm-hmm. And we just actually probably the last few months we've started doing free rides. So if they don't have a transportation, we can come pick them up from their home, take them to the clinic, and then take them right back.
Oh, what about from the prison?
We'd probably do that too, as long as they go into our location.
Oh, wow.
Yeah.
You know what? We're going to look into that a little bit more. I'm going to obviously pass that information because I know people that need rides and they want to do that, right?
Yeah.
I know I did. And there's lots of people that are worried about it. So yeah, great.
Yeah.
That's a great resource.
It is a great resource.
When someone's getting out, is that pretty high on the list as one of the first things to go check in on your health, to make sure you're getting some attention for your addiction that you're coming out of? Do you think that might be the possibility?
I think it should be. I think money can be an issue for people, and not knowing the resources out there is a big problem. Yeah. So we actually do payment plans. We go off of their income, and so we will adjust what they owe, and we will literally not charge them the very first time they come to visit us. We basically work with them on what they can afford.
What about pre-existing conditions? Somebody comes out with high blood pressure or diabetes. Is there help for them?
Yeah, we have that. We have providers that will definitely help them if they're beyond what we can provide. We'll give them referrals, which will get them in faster.
Okay.
And then we even have behavioral health, which is counseling.
Oh, that's a big deal.
And our counselor actually has a pretty empty schedule, and so we're really easy to get into. So
yeah, that's a rarity.
Yeah, it is.
Yeah.
One of the things that we have talked about before here is that mental health, I don't think anybody realizes it, but everybody that's incarcerated needs mental health.
I think everybody.
Yeah, everybody, period. Yeah, anymore, yeah.
If they didn't a year ago, they do now.
Yeah, that's right.
So are there mental health counselors at your facility there?
We have one. And we see 18 and above. And if anybody were to come, we would try to help them as much as we could. We prefer if she only speaks English, but if it's an emergency, we do have a program that we can do translations. And so we would try to get them help and then refer them to somebody in their same language.
Oh, that's pretty neat. That's a big resource.
It's a huge resource, yeah.
Yeah.
And the sliding scale actually also applies to her. So if you are needing mental health services, the sliding scale actually reduces their payment based on their income and their household size. And no payment is due at the time of the appointment. Rather, they get billed, and then they could set up the payment plan.
Oh.
They can easily get, if they can only do $10 a month, that's okay.
I can't tell you how many people come through our front door asking about, hey, how can I get some counseling? A lot. Yeah. And and honestly, I think we've talked about this before, but it kind of flew right over my head. Now I understand that you're a resource that we need to start making sure everybody's aware of, because people are out there walking around needing it.
Yep, for sure.
Andrea is our counselor, and her specializes in trauma. So I think it would be perfect for them. So.
Yeah. I mean, do you find it the challenge of being like a publicly funded place? Like it's Central District Health is the county, right?
Yeah, it is the county.
And so with that doesn't come a huge marketing budget, I bet.
Oh,
That's
no.
True.
Yeah. Okay.
We don't have much of a marketing budget.
Yeah. This is your marketing budget.
This is, yes.
And the
yes.
cost is very low, yeah.
Yeah, it's me calling, doing a lot of soft calls, and just letting people know that we exist.
And so when you reach out to IDOC to tell, the inmates, right, about this program, right now it's just an informal project. It's just something you've taken upon yourself.
Yeah, so just educating them, just so that they know there's resources out there.
Right.
And I supervise our community health worker, Rosie, and she also helps with, just getting them onto programs for resources. And so housing's big right now, and so she can help them at least find the resources that they need.
Yeah.
Oh, yeah.
You're on the front lines, Rosie.
I am.
Yeah. So when somebody comes in, what happens?
So I introduce myself. Some people open up right as they meet me. Some people takes a little bit of a time. But I just explain to them what I do. I'm in charge of the community closet. And I said, is there anything I can help you with? I'm here if you ever need assistance. Some people say, yes, I do need this, and that. Or some people's like, yeah, okay, I'll give you a call. I think it just depends on the person, but I can help from, I don't know, from as easy as referring to a different place or helping them with an application for employment, for Medicaid, for their child's passport, which I used to do part-time. And so and if I'm not sure, there's a lot of calling. So there's a lot of trial and error, like calling and informing myself. A lot of the clients that I get are Spanish speaking only. They may need help translating a paper from what they receive, and I just help them with that.
Good.
So
if I had to make a list, I mean, let's just say, you mentioned the word community closet.
yes.
And we'll get into this a little bit more towards the end, but you guys you don't just do the medical, the assistance with the medical and the assistance with the mental health, but you also do some other stuff.
Yes, so we have the community closet. We do that, and we have
Resource center. We have a resource center. So basically anything that they're looking for, really, we just go and help them find resources. And sometimes we're learning with them.
Oh, yeah.
we are.
And sometimes we are experts in it, but it just kind of depends on what our experience is. And that's what a community health worker is.
And also just having connections like with you and other community health workers from Terry Riley, from St. Alphonsus, from which I've met, and they're so nice, and we help each other. Hey, I have a client who's looking for housing. Do you know anything out there? And we just help each other. I have Anna from Mountain Home, and we also keep in touch. And so it's just building connections and helping that particular client with what they need, hopefully to get them to the right place.
Yeah,
if we are not able to offer it, refer them like a soft hand to someone that you do know that can help.
That's great. And because it's not a formal health service network, right? These are just connections you've had to make.
Yes,
You create your own network.
Salvation Army with Tracy, the St. Vincent de Paul. There's a lot of out there organizations that we have meetings. I think this coming next week, we'll be having a meeting for a family collaboration. We meet up, we talk about services, what their events are coming up, and then that's how we know what's going on here in our Treasure Valley.
That's great.
Awesome.
That's great.
Yeah.
There's just so much work to do, isn't there?
There
So much
is.
connecting.
And
So much
actually,
connecting.
Boise's really good about having resources. We really do collaborate really well. And so I just have to keep my ear open like, oh, that's somebody that we could probably connect with and have a partnership with.
Yeah.
And so that's my job, is to make sure that we have those connections, and then we get the education, and then we can share it with others.
That's terrific. So when someone comes in, Rosie, how long are you helping them?
Depending. So
Can it
I
be
could
over several months?
I could be, yes. So I actually had a case where before getting this position, they were already doing it 2 years. I became a community health worker back in November, and I met this family in March, and I started on her case. Her goal was to get on developmental disability through health and welfare. Well, no one had done the application. So I started, but we had to go back all the way to California when they were kids, get all the records, school records, medical records, any type of things, because they unfortunately didn't bring anything when they came. And so I just had to gather a big booklet, and there was 2 clients, sisters. And so just getting all that, getting all the ROIs, release of information, permissions, and talking. Finally, I accumulated all that information that we were able to send it to Health and Welfare, and then Health and Welfare sends it to Liberty Health, and then Liberty does an assessment as well as doing other assessment through the psychological testing for autism and whatever their disability is. So finally, we are reaching out to the Bloom coordination, which they gather everything so they can start receiving their services. They have a tour coming up for the WICO in Caldwell. And so if they like it, they will going to start doing their services, transportations, job search, help with just living day to day, teaching them. So that is our goal. So we are getting close. And this has been probably a journey for them, 3 years. And for me, it's been almost a year now with them.
Amazing.
Working.
Oh, awesome.
Amazing.
So yes,
Yeah.
it's a lot of hand holding. which a lot of people do want that and need that. A lot of people don't. Maybe people could do it on their own. But this particular family, they needed a lot of me calling, hey, have you received my paper? Did you receive my paper? What's the next step? And just constantly calling.
Yeah.
It's a learning curve, and once you get that down pat,
Yes.
you're going to be a champ.
Yeah.
Not that you're not already a champ, but you're going to be a big-time champ, right?
Yeah, so it's actually definitely something that I've never done, and I was learning as I was going, and Andrea, too, was really kind to helping me and guiding me and stuff, and so she helped a lot. The client spoke Spanish. The mom did, and the two sisters, they're bilingual, so it's a lot of help that I did, a lot of calling. Maybe something that maybe it just made it difficult for her to do, but I was there to advocate for them.
Good.
Yeah, that's great. Well, in case you're just tuning in, this is a show called Reformed and Real. I'm Wayne Burt with my co-host Mario Hernandez, and we're joined by Christy Lacados, Outreach Coordinator, and Rosie Fernandez, Community Health Worker for Central District Health. We're going to take a quick break, and we'll be right back.
All right, everybody, we're back, and we're going to keep on going. We have Christy and Rosie right here with us, and join with Wayne. So continuing that conversation, one of the things that I kind of wanted to nail down a little bit, so many people don't want to do anything for them or help them, and I think when you get out of prison, when I got out of prison, I was like, who do I ask? You know, there's only a couple of people that have to help us, and one of them is health and welfare. They have to help us. And that's kind of it. Are you guys used to dealing with clientele that are from Idaho Department of Correction? Have you had many interactions with them?
I have, yeah. I'm at the clinic side too. They let me know I'm just starting. Where could I go for housing? I don't have any clothing. I would love some assistance just getting a job. And that's where I come in and say, yeah, we could do health and Idaho Department of Labor and clothing we have here, and just kind of get their motivation also going that, you know, we're here for them.
Kind of another important part of that is when they get out, just say I get out, I'm out today, I'm coming to you and I'm like, hey, I need a mental health evaluation, and which you already talked about, and I need a checkup, which we already talked about. And one more thing is I've got 4 kids. So am I eligible for WIC?
We'll ask a couple questions.
Yeah.
Yes. Yes, so definitely under the age of 5. But yes, if they are the qualifications, we can certainly get them on the WIC program, get enough set appointments for mental health, and if they need a checkup, we can certainly do that there too, all in the same place.
Oh, good. So that's a big deal. When I'm getting out of incarceration, I have a lot of worries, right?
Yeah.
I've got to worry about a job, a home, clothing, a car, my family, and so many people, especially, not especially, but mostly women, when they get out, they've got babies.
Right.
And so they can just come to you, right?
Yeah, so even in our lobby, we have a hygienist that will come and look at their teeth. I feel like little ones are constantly getting neglected because they don't think they need to be seeing a dentist, but sometimes they have milk rot, you know, and so if anybody's complaining, or sometimes we just have the hygienist come and just say, do you mind if we look at their teeth? And they'll put sealants and fluoride on them with our oral health program. We even have a nurse family partnership where if it's a first-time parent and they're just finding out that they're pregnant, that we could hook them up with that family program. And we even have a Parents as Teacher program for those that want home visitors to come in and just help them engage in educating their child and getting ready for milestones.
Wow.
That's amazing.
That's a very good service. That's awesome.
Yeah. So we are an affordable health care for the whole family. And so often people think, oh, I have to be this certain age, but we're ready for the whole family.
So have you ever had anybody that when they get out of incarceration, and I'm just shooting these at you because I used to be there. So if they don't have food for their baby or their child, you guys can help with that, right?
Absolutely. We have a whole list of all the pantries, the food pantries around. And a lot of times we will, even if they don't qualify for WIC, we can give them a gift card or something to help them get started.
Oh, but the under 5 qualifies for WIC, right?
Yes. Absolutely.
What comes with that? What does WIC offer for them?
Well, usually you want to speak on it? She was actually a clinical assistant.
Yeah, so the package, I think it just depends. So if the mom's pregnant, they would get milk, cereal, eggs, bread, and tuna fish if they're breastfeeding. And when they're a child, they would get kind of the similar package: whole milk, cereal, bread, beans, rice. And if they're infants needing formula, then we'll offer formula for the baby.
That brings back, that's nostalgic to me, just so you know.
The Kicks.
The Kicks.
Yeah.
I think we said that the last time we talked. I remember the Kicks cereal.
I do too, a lot.
And you remember where you got it.
And I remember exactly where I got it. We used to go to the WIC office with my mom. That being said, it's not and I gotta say this, right? So it's a beautiful thing and it's not a waste, right? I'm here today, healthy, happy, walking around, because of what WIC did for me. So on behalf of people like me, we thank you and we thank the service you give to the community because it's amazing. It doesn't really matter where you come from.
No.
I think that some people need it and some people don't really want to get it. Right.
And with that, if someone's on Medicaid and they feel like they're already getting assistance, we want them to come to WIC because we're a nutrition program.
Yeah.
So we are basically helping them and educating them on what to eat and what's healthy because not all of us grow up knowing that.
Sure.
And it changes all the time. And so we really want them to come and get that nutrition education. And we've made it so easy where they have a phone app that they can basically have all their information on that phone. They can get nutrition education on that phone. And so we just try to make it as easy as possible so it's not hard. And we want them to be able
those big checks.
Yeah, I had the big checks.
I remember seeing them, and one check was for milk and the other check was for cereal and something else. But
yeah. So now hopefully there's not a status on it, and we really do want people to be able to come and just know that it's a nutrition program. That we're just trying to get them ready and set. We have breastfeeding support for them if they want to breastfeed. If they can't breastfeed, that's fine. We're going to provide formula for them. We just want healthy babies.
Yeah.
Oh, good. Can I ask you a question about what's your budgeting like? What's your funding like? How's that look?
We've been really fortunate, to be honest with you.
That's what I thought.
Yeah. Our director has been really transparent. He does town hall meetings with our employees, and even during all this crisis with almost shutting down and then finally shutting down, we basically had funds that he was supporting. He wanted WIC to continue, and he'd give gift cards to people that couldn't do it. We had the lawful presence law that ended up really affecting our refugees, and he's been really good about supporting the community and our employees. So basically the funding, we've had extra funding from our district, and so he's provided that for people.
During these hard times, but
we've been very fortunate. I feel like we are very happy employees there because we can really help the community, and you can tell that our director, that's his goal, is to get help out for the community.
What's his name? I want to put him out there.
Russ Duke.
Russ Duke?
Yes.
Russ, thank you very much. That's
Russ.
Probably one of the best things I've heard all day. Well, it is one of the best things I've heard all day. When somebody actually has some, he's, what is it, foresight?
Sure.
To know that something's going to happen. And I think that's where we're at as a community, right? We have to have the foresight. We have to be looking ahead to see what could happen. And what an amazing person and what an amazing program.
Yeah.
Are you able to take anything from the community, or just donations for like your closet? Do you guys take donations to what you're doing to like WIC? How does that work? I don't know. Because you're a county agency.
So WIC is a government agency, so we don't take any donations for that. They're very strict on funding on that. But the community closet, we actually get a lot of people that come and get stuff will actually come back with their own clothing because they're like, hey, this has helped me. Maybe we can help somebody else. Right. And so we do allow that. And
I think they will allow other things. Stephanie mentioned that if somebody wanted to donate either money or things like that, we are able to accept it. We'll just have there's like a little process that they go through.
All right.
But yeah.
Oh.
We haven't had much. It's we've only been been around for about a year now. So
well, you've got an amazing setup for a year. It takes a lot to get resourced in the community the way you ladies are, and it gives us hope, right? It gives us hope for the community to have this other thing. And when it comes to, especially, and I hate to keep coming back to this, but when you're like myself, getting out of incarceration, and every resource counts and matters. I can't tell you how many people that go to get health and welfare and they give up right when they start. And some people just need that advice. You guys advise them to that, right? Like, hey, this is what you need to do. And
we advocate for them, of course.
Good, because we got people that get frustrated, and some people that they've got obviously mental health issues that will be going to you for the two reasons: one, mental health, and maybe a little bit of help, guidance.
Yeah. I'm actually helping a client right now. She just went through domestic violence, but she literally just said yesterday, as I was, helping getting things done with her. She said, "Oh, you're my angel. I don't know what I would do without you," because going through all the court stuff, the reviewing of all the paper and the court appointments and all that stuff. She's like, "I don't know how would I do everything?" And just me translating all that to her and telling her these are the steps. It just made life a lot easier for her.
Yeah,
so
that's great.
Yeah,
just knowing they're not alone and have advocates out there is huge.
Yeah, absolutely. That's a big deal. Yeah.
Yeah, so it sounds like you're still, each of you, energized by your work.
Yeah.
I love my job. Yeah,
Good.
I do.
That's great. And so, but the work continues, and I guess the main thing is to just try to expand awareness of all the things that you offer.
Yeah, I think that's the biggest thing. Like our Rides to Wellness hasn't been actually used very often for the transportation, and we put a lot of money into it. And so we were hoping that people will start using it, because that's what we always hear, that it's the transportation. But really, we haven't had many people use it, so we're trying to get the word out.
Well, good. So let's do that. Let's talk about that one more time.
Okay.
So Rides for Wellness, or Rides to Wellness. If you're out there, you need some mental health help or some Medicaid assistance or helping getting it or any of the sorts. So talk to me about how I do that.
So basically, we would call our number office if you're not in the office. Our local number, it's 208-327-7400. If whether it be for WIC or medical, you just say I need a medical appointment or I need a WIC appointment. This is what I'm going through, and they'll set you up with an appointment. You'll be at the office, and we'll start from there. A lot of the just questions, they'll go by phone, and then we'll set up an appointment for your next interview or appointment.
And then they would call. We'd give them the information to Rides to Wellness
if they need it.
And then basically they would call, set it up, say this is when my appointment is. They'll make sure that they have a ride, and then they'll ask for an estimate of when they need to be picked up. And if they want time to go look in the closet, they can give themselves some time, and then they can have them pick them up at a certain time.
So just to repeat that, that's an underused resource.
Yes.
Everybody.
Yes. Flashing lights.
Yes. This is an underused resource. The funding is there, so let's get out there and do it. We appreciate you guys, and and obviously a resource for the greater Treasure Valley, right? And I just want people to just know that they have this resource there, and my people getting out of incarceration, use it before you lose it.
There you go.
Sure.
Today's mantra.
Yeah.
Well, thank you for having us. It's been a great opportunity.
Yeah,
to
it's
speak
been
with
a
you.
pleasure. Thank you so
thank
much.
you.
And thanks for the work you do.
Yeah, thank
Yes,
you.
thank you
Thank
very
you for the
much.
work you guys are doing.
Oh, yeah.
Thank you. And And that'll be it for us. And thank you for joining us right here on Reformed and Real. And we'll catch you on the rebound.
Catch you on the rebound.